the U.S. Surgeon General issued a call to action to prevent DVT and PE, which emphasized public awareness about the risk factors, triggering events, and symptoms of DVT and PE. And then in April of 2009, the Joint Commission standardized hospital performance measures for the prevention of stroke and VTE. And most recently, NATF has been crucial in healthcare reform debates, particularly surrounding the testing of generic low molecular weight heparins and its effects on patient safety. So with that, I'll turn it over to Elle Howe, our Education and Outreach Coordinator, who will tell you a little bit more about NATF membership and our advocacy issues.
Thank you, Caroline. Hi, everyone. Once again, my name is Elle Howe, and I'm the Education and Outreach Coordinator for the North American Thrombosis Forum. My role at NATF is really to save lives and prevent blood clots through educating the general public, patients, as well as healthcare professionals on the recent developments on thrombosis research, education, public policy, and advocacy. I'm also here today to inform you of ways in which to get involved with NATF. So without further ado, I'm going to start about explaining our NATF website. Our website is www.natfonline.org. And here you can find information on all our past and upcoming events, which Caroline and Dr. Goldhaber had mentioned. You can also find thrombosis facts for patients, providers, and advocates. In fact, we recently added an interactive DVT-PE risk assessment tool in which it asks you a number of questions, and after answering those questions, it assesses your risk for developing a DVT or PE. I encourage you all to visit our website and try it out. We also have some contact information on our website. If you click on the link to the left, it'll give you two links at the bottom, and you can click on staff and office contact to contact either Caroline or myself. You can also find ways to get involved on our website. And lastly, you can register to be an NATF member. Hopefully after hearing from Caroline who we are and what we do as an organization, you'll be more apt to become an NATF member. So with that, I'm going to talk about the different perks to being an NATF member. As an NATF member, you have access to our online medical journal called the eThrombosis, which I will talk about further on in my presentation. You'll also receive a 25% member discount for all our educational events. Thirdly, you'll receive a membership card highlighting your username, password, and discount code to use when you register online to obtain that 25% discount. And lastly, you'll receive our monthly NATF newsletter, which highlights all our NATF activities within the past month. We currently have 4,337 members and counting. Something interesting about our members is that we have members in over 47 states. We have members in over 75 countries, and a breakdown of our membership as of December 2010 is that we have 37 pharmacists, 16% nurses, 17% other patients, 23% doctors, 3% students, and 4% PhDs. So as you can see, we encompass a wide variety of people. So now I'm going to talk about our online medical journal called eThrombosis, which I manage along with Dr. Sasahara, who's in the audience today. Our eThrombosis is basically an online medical journal for healthcare professionals affiliated with NATF to write about their recent studies or research regarding thrombosis. However, we also have a patient eThrombosis in which patients who've been recently diagnosed with DVT, PE, can share their personal story, convey a personal message to the general public, as well as share what you've learned since you've been diagnosed or treated with a DVT or PE. If you're interested in writing for the patient eThrombosis, I encourage you to please contact either Caroline or myself, and we'll be more than happy to get you started. For those of you who've been keeping up with the times, we have a variety of social media outlets. We have a Facebook, Twitter, LinkedIn, and YouTube account. For Facebook, simply search our organization's name, and you can ask questions on our wall, participate in the discussion boards, view pictures from our previous events, as well as find information on our upcoming events. We also have a Twitter in which we tweet about recent news and updates regarding thrombosis and NATF. We have an NATF group in LinkedIn. And lastly, we have a YouTube account. Simply search for NA Thrombosis Forum, and you can immediately view all our educational videos, interviews, and patient advocacy videos. And lastly, we have a patient advocacy committee. Currently, we're going through a transitional phase, and we're trying to restructure and reorganize what the patient advocacy committee should focus on, or the direction of the patient advocacy committee. With that said, we are seeking new members, and we're hoping that the advocacy committee really plays a large role in educating and reaching out to the general public. With that said, we're open to any comments or suggestions any of you have on how to, on what we should focus on as the advocacy committee, or what direction we should take. Here is our contact information, which lists our address, phone number, and email address. Feel free to contact us at any time, and if you're interested in registering for our 2 events in April, please visit our booth. I also want to thank Julia Tai and the Anticoag for giving us this opportunity to tell you about what our organization is. Thank you very much.
If anyone has any questions before we step away from the podium. Good job.
Hi, everyone. I'm Julia Tai. I'm very lucky to be the manager of this service, and this event has just made my position just very rewarding to hear your stories and your questions and your comments. So for these last 10 minutes, I'd like to invite the speakers back up. Please stand at the front so you can continue to ask questions, and afterwards you can ask some questions on your own. Okay, so any questions to start off with? Dr. Goldhaber, please join us up here as well. The patient has said that she's had 1 pulmonary embolism in the past, and she's wondering if she should be continually thinking about it. So Dr. Goldhaber, can you?
Actually,
Yeah, I think this is a question that Ruth and I
don't really need this.
a lot.
Yeah, I think that if your pulmonary embolism right now is not bothering you and you don't have any physical effects or psychological effects from it, and it was caused, and you can determine the cause of your pulmonary embolism, then you probably shouldn't give it a second of thought, and you've treated it and now really don't have to worry about it as much. People that have more psychological problems are the people that don't know why they had a pulmonary embolism. They're idiopathic, or they came out of the blue. And those are the people that usually have more worries and, need support groups and wonder if it's going to come back. And you're welcome.
Okay, there. So the question is, he's going to have a cataract surgery, and he's wondering what he needs to do with his warfarin. Any number of us could answer that. Dave,
yeah, I'll take that one. Around certain procedures, you need to come off your warfarin before you have them, so that your risk for bleeding is low. But for a particular cataract surgery, you don't need to come off your warfarin. You just we like to keep good control around the time of the procedure anyway. So keep in touch with your anticoagulation manager. Let them know when the procedure is, and always let the surgeon that's doing the procedure, or the doctor that's doing the procedure, let them know that you're on warfarin too, and that you're managed by us. And you can even tell them if you like the last INR to make them a little bit more comfortable.
My name is Renelle Stevens. I think you probably heard my name referenced. Some of you I know I manage. I recognize some faces, and I've definitely heard some voices today. It's great to put a face to the name. And just to add to what Dave said, he's absolutely right. We want to keep you stable around the time that you have cataract surgery. Whenever you have any surgery, it would be my recommendation to call us and let us know, and maybe even provide the phone number and the name to the person that's performing the surgery. In many instances, we work together with whoever that person is to find out. Much of the time, it's their discretion. It's their discretion, and it's our trying to make sure that we're keeping you safe, whether it be you need to be lower, past experiences. So there's not a one-line answer to that question is basically what I'm trying to say. And in many instances, it's just better for all of us to work together with whatever healthcare professional you'll be having a procedure with.
Okay, so the question is, what is the relationship of caffeine to the INR?
That's a great question. Oh, Dick, what do I do with you? So Goodness, I mean, I can't tell you that I know the exact answer to that. I can tell you that I'll look into it. There are many things that I don't know the answer to. I can definitely look to see if there's some strong correlation. I don't believe that there is one, but, again, I don't know the answer to that question. But I will follow up with you.
So the question is, for a procedure, sometimes we have to be admitted to be on heparin. So are there other options where you don't have to go through the hospital admission?
So I think a lot of these situations are too individual and too complex for us to deal with in this forum. I think on the horizon, though, I did mention the novel oral anticoagulants like dabigatran for those of you who end up on it, or one of the other ones we didn't talk about today, will provide an opportunity to simplify the whole bridging procedure.
The question is, what is the relationship between exercise and the INR?
That's a great question. I mentioned that in my talk that exercise can affect the INR, and it's not something that is going to happen very quickly. If you, after 5 years of being on this medication, went for a run yesterday, doesn't mean the next day your INR is going to change. But the relationship is that it decreases your INR over time. So if you were, for example, training for maybe a marathon, or if you were doing a lot more exercise than you typically ever do, and it's consistent, your levels will start to come down. You'll need a little bit more and more warfarin, but it's typically a very slow decrease. So usually we can keep up with it with your warfarin dosing just by testing at regular intervals. I think that's exactly correct. The question was, does it affect the metabolic rate? And exercise can maybe increase the metabolism of this medication, so you're excreting it at a faster level than you typically would. So it's coming out of your body faster than it's going in, and you need a little bit more to keep you in that steady state and your INR up in range.
Question?
For someone that is exercising during different seasons like you and not during other seasons, have you noticed anything so far? Have you been doing this for some years? Okay. So it's a very individualized basis. Sometimes we don't see much of an effect at all, and other times we can identify effect. And it's not going to happen to a point where you have to be testing daily or weekly. I think it happens over time. So still testing at your typical intervals is fine. Letting your warfarin manager know that you're starting this exercise cycle and actually seeing what happens will be the important thing. Because if you're on this next year, we can kind of plan for it. And well, this is what happened last year, and let's go ahead and start to adjust for it now, this coming up here. So it's a very individualized reaction or basis. So, for one person it might be different for the next, but it's not something that happens overnight. It's something that happens over a great deal of time.
So we can take one more question. Up at the top? Yep. Thank you for sharing.
I just want to also, before you close out the program, thank you, Julie, for your management of the service, and John for your exemplary introduction, historical and otherwise. And as you see, I think you heard after the coffee break, again, this is ongoing. So for the half of you that have pulmonary embolism or DVT, we offer this support group on March 23. And then in April, we have the programs April 28 and April 29. For the healthcare professionals who want to go much more intensively, we have a 5-day Harvard course that I run on May 1, and then we'll catch our breath and reconvene September 24th. And all the meanwhile will be really with Caroline and Elle building up the Advocacy Committee and many other aspects of NATF with their full-time support there. So it's speaking for me, Brigham has been my career, my home, my professional home, and the most wonderful thing about it is to have mentors like Dr. Sasahara, and really just such a vibrant, active, committed group of people to work with. Thank you.